Welcome to Leadership Forward, where you'll meet Arizonans with innovative answers to our state's greatest challenges. I'm Dawn Wallace from the Arizona Center for Civic Leadership at the Flinn Foundation. Hi, welcome to the podcast. Today we'll be discussing the health and well-being of Black women in Arizona. This is a particularly important topic for me as a woman and as a mother. Black women experience the highest maternal and infant mortality rates in the nation. In 2020, the National Center for Health Statistics reported that the mortality rate for Black women was 55.3 deaths per 100,000 live births. Black women are more likely than white women to have C-sections, to have their pain minimized or ignored, to report mistreatment, and have stillbirths. So why do these disparities exist, and what can we do to improve the health of Black women and children in Arizona? To talk with us about this very important topic, we welcome Teniqua Broughton, the founding director of the State of Black Arizona. Welcome to Leadership Forward for a Better Arizona.
Oh, thank you, Dawn, for the invitation and the ability to talk about the work that the State of Black Arizona has been doing in the last few years.
Well, we appreciate having you here. So this data is really shocking.
This data is very shocking. And it's hard to actually do this work each time you see the data and it's not faring better. It's actually getting worse. And I know you shared early about the maternal mortality rates, but it is even worse when you think about what is happening in South Phoenix. So across the state, the percentages, I think, reflect a little less than 5%, around 4%. But in South Phoenix, when we talk about maternal infant mortality rates, it is unfortunately 14%. And so there are organizations like Healthy Start South Phoenix who are working to oversee that. But the challenges just everywhere across our state are challenging.
So this is work that you've been doing for many years now. In fact, in 2021, the State of Black Arizona released a report, the health and well-being of Black girls and women in Arizona. And there was a lot of research, not only about the maternal and infant mortality rates, but also in general, the health of Black women in Arizona. In it, the data sort of downplayed the notion of genetics and lifestyle as a major contributor for these disparities. And in fact, started the conversation around social determinants of health. So can you tell us a little bit about what that means in this context? And what does it reveal in terms of the gaps and opportunities available for Black women and their children?
Yeah, thank you for that question. And, I want to respond to that question, but I also want to make sure that the reflection of my answers as the leadership of the organization is really a summary of the data and the research of our experts from the report. So not an expert on it, but I am summarizing a lot of what we have talked about, what we have spent time with, and how I would say we view things outwardly to really make sure everyone understands that. So that report was commissioned by the African American Women's Giving and Empowerment Circle. So they came to us and said, we would like for you to do this report. This is an area of interest for us. And so in looking at that, we did really dive into the social determinants of health. And for many of us who may know or may not know what that is, social determinants of health really is about looking at how it determines economic stability, healthcare, and quality, as well as the ability to understand how someone can navigate their environment and et cetera. And so the report is very revealing because it shows that we really have an uphill battle on a number of different issues from birth to death. When we look at it in Arizona, it also is very different. There are a few comparisons nationally, but we still have our own trends that are showing up in our state very uniquely. What you may think is happening for Black women in another state may be different in Arizona. And so I think understanding that the data and research is telling us a story, we need to actually pay attention to what the data may be telling us or not telling us, as well as the lived experiences that compare or don't compare to it, to do a better job around the systems changes for Black women and infants in Arizona.
What are some of those unique factors that are Arizona specific rather than part of a national trend?
Yeah, so one of the things I think everybody first was like, what was the leading cause of death? And I think the first thing people was like, is what's cancer? But if you look in the report, it actually is diabetes. And so that heart disease, that was really, I think, hard for people to be like, oh, well, we thought it was this one thing. But when you start looking at social determinants of health, and we're talking about how people are living, their social and emotional health, their mental health, those things were very challenged in some of the data we were collecting. And unfortunately, we weren't able to share it very specifically in the report around privacy concerns because the numbers were not that high. We had a challenge around being able to get data in some of those areas. And so you just want to make sure that you're not putting out anything that is suppressed or challenged in that. But we know that from the stories that are shared, from the work that is being done by practitioners, there is a lot that needs to be done in this space.
So in the report, there was a particularly heartbreaking sort of correlation between individual trauma and the disproportionately high instances of chronic illnesses like diabetes, like breast cancer. That's a pretty shocking statistic in Arizona. The Black women have the highest rates of breast cancer in the state amongst different subgroups of women. So can you talk a little bit about the work and research around the connection between ACEs, trauma, and the incidence of sort of the unhealthy, circumstances that correlate out of that?
Yeah, I'm going to share it from my perspective because I think our experts would answer this probably a little bit differently and with more in-depth experience. But what I would say is the correlation of what you saw in the report is that our challenges of what is happening from the birth of a child is almost carried throughout their entire life. And so if they're not getting the support and needs and that care early on, and then you become a young woman to then becoming a woman who is caring for their family, who generally then puts your family first in care and not taking care of your own needs, it may compound some of these issues that are being created. So what I would say to what I saw in what I saw in our report and in the conversations of listening is that in Arizona, we have an issue around ACEs. And it's not just African-American youth. Our kids are experiencing trauma much more than most kids. So that in itself is challenging. And why are there so many traumatic experiences happening in their childhood? So that's affecting them. I think when we think about care, when we announced last month that we were going to work on a mother and infant in health in Arizona report, so many women came up to me to share with me their stories, mothers, inspiring mothers, and even single women talking about their interactions with healthcare providers and practitioners. And very daunting stories that brought them to tears, stories that if they didn't get the care that they needed, they would not be standing here in front of me. Stories where they had to demand the service that they needed. Stories where they had to research and really be almost their own doctor. And there are so many great people who are working. I think of Dr. Sharon Thompson, who has been a great educator of this and is in the report. But it's sad to hear the stories over and over again around women not getting the care that they need to be their best self for themselves, but also for their family and their children.
Well, so let's talk about the Black Maternal Infant Health Campaign that you are embarking on in April for the next year. It's the sort of the national week is April 11th through the 17th, but this is a topic of significant priority for the state of Black Arizona. So tell us more about your campaign and what you're going to do.
So again, I'm going to go back to the African American Women's Giving and Empowerment Circle, because I think they understand that the work that we are doing when it comes to the data reports require action, and they want to constantly embark on that. What I didn't share earlier about is that when we did this health and well-being of Black girls and women report, they acted upon it by putting out a philanthropic ask. So they did their giving for a year for proposals from organizations specifically to focus on the issues that were addressed within that report, which is great. And I think they want to go further, which is why we are moving forward with the campaign. In January, they did a viewing of Aftershock, Hulu's Aftershock documentary, which documents stories of unfortunate maternal mortality challenges that have happened in a particular state, New York, and the fathers who told the stories about what happened to the mothers that have their kids and how they are moving forward specifically without them understanding that they could have had the care to still survive. So with that, the state of Black Arizona was like, okay, it is time to move to the next step. So our campaign really is about a few things: building awareness, it's about activism, and to create a call to action around the initiative to amplify these improvements within the system. So, it is about treatment, it's about access, clinical measures, and the lived experiences of Black mothers. So we just don't want it to be a data exchange. We really want to facilitate the understanding of the new data with an equity framework. So we've kind of moved from, we understand some of the social determinants of health challenges, but now there's a framework that we think can dive a little bit deeper into to support some of those gaps. I think understand that cultural context and give an opportunity. So instead of just putting out the report, the campaign is about putting out a number of different white papers with videos and a social media awareness around some of what this data means. So we are in the stage right now of solidifying our relationship with March of Dimes to utilize their Ignite Together campaign, which is a national equity framework, which has 5 different strategies. And so we want to embark on 3 of them with them for this campaign. One is dismantling racism and addressing unequal treatment. The second is increasing access to quality health care. And then the third one we want to utilize is safe and connected communities. So of the 5, those 3 would really carry us through the next year, where we would put out these white papers and have conversations that would hopefully turn into a convening and an ability for people to actually give us their feedback, and it could turn into a report as of next steps.
So thank you for that. And thank you for this really important discussion. So you are my first guest on this podcast. I couldn't ask for a more amazing leader and human. And I'm so blessed to have gotten to know you. You are a Flinn-Brown Fellow. This is Leadership Forward. So we're going to talk a little bit about leadership. You are a Flinn-Brown Fellow of 2013. Tell us about that experience for you and how it led you into the work that you're doing right now.
Well, Flinn-Brown, I mean, you know this, Don. I am always promoting. I actually just left a lunch and I was like, you need to apply for the Flinn-Brown program. But my story is very interesting in the fact that Flinn-Brown really helped, I think, platform my ability to have strength for leading the state of Black Arizona. So when I was in the program, I was actually leaving another nonprofit organization. And then I went through the program. And when I finished the program, right before I finished the program, I was introduced to the organization and was asked to look at completing their volume 4, which was on arts and arts education. So in the process of doing that project and able to really secure some funds to keep me on, what I learned from a high level in the Flinn-Brown program really helped me, I think, be a better leader and a real founder, like taking the steps to say, okay, Teniqua, you can do this, because now you got that policy piece. Now you understand the bigger picture of how the state works. You understand budget, you understand water, you understand, access. And so for me, Flinn-Brown is a part of my journey. It's a staple to my leadership. I don't like to miss the conferences. I unfortunately missed my last conference, but I like going to our alumni, our fellow conferences. I like to participate as many sessions as I can, always understanding what is the recap around the legislative session. I love that session. But I will say this, the network is amazing because I have some real friends in there, but I have some colleagues that help lift me up as I lift them up. And Flinn-Brown has definitely changed my life to look that leadership and civic leadership is way beyond just what you think you should do in the community, but it is extending yourself to the place where every part of you being social, emotional, and engaged in the way that you didn't think you were is what you get out of that program.
Thank you, Teniqua, for your continued leadership and your work helping people in our community. And to learn more or get involved in the Black Maternal Infant Health Campaign, visit the State of Black Arizona website at stateofblackarizona.org. Thank you.
Absolutely. Thank you.
That wraps up this episode of Leadership Forward. You can find out more about the work of the Arizona Center for Civic Leadership at our website, azcivicleadership.org.